Hi everyone, my name's Lane Raspberry. I'm going to present WikiProject Clinical Trials. This is an effort to bring information about clinical trials, which is medical research, to Wikidata and the Wikimedia space. I did this at the University of Virginia. There were a lot of other people and projects who contributed to this WikiProject Clinical Trials effort. I'm going to give more credit specifically to these various people and organizations throughout the presentation, but I want to emphasize right from the beginning how easy it is to collaborate across disciplines in the Wikimedia platform to do things that matter both for Wikipedia, Wikidata, the Wikimedia projects, and which also have relevance to research that people are already doing, existing projects outside of the Wiki space. To give an outline of what I'm going to cover, I'm going to start by just saying what we did in this project. What did we do with clinical trials? I'm going to explain what this means for our Wiki community. What can we do now that this information is in the Wiki platform? I'm going to give some background on Wikipedia and medicine. Wikipedia has a long relationship with the field of medicine. It's influential in sharing health information, bringing in information, and delivering it to the right kind of people. I'm going to give an explanation of how we did this and then open it up for discussion about what might come next. In all of this, I want to start by saying, even though this is a medically themed project, what happened here is a model for how universities or other kinds of research institutes or anyone with data sets can engage with the Wikimedia platform. So even if medicine isn't your particular interest, you can consider the activities that we did in this project as a precedent for engaging with Wikipedia in other spaces related to data. So what did we do? There's a United States government website. It's called clinicaltrials.gov. We imported records from this website into Wikidata. Now, a clinical trial is medical research on human subjects. So anytime there's an experimental drug or some kind of test of a procedure or an intervention, and it's going to be happening in human subjects, meaning not animal trials, not theoretical planning, if there's human test subjects, and that's a clinical trial, and the custom is that these need to be registered in advance in this database, this United States government database, if it's happening in the United States. We were able to import over 300,000 records, almost all of the records from this database, some parts of these records, into Wikidata. And this last number that I have here, 170,000 clinical trial phases links, I'm sharing that to show that most of the original records of clinical trials, they had phases links. Not all of this data translates into Wikidata. There's different things that comes up. Some of these don't apply. And if we look at the different records, the 300,000 is the total number of possible trials that we could have imported. And then for every other characteristic of the trial, we're not importing all the data. There's different kinds of things that we're able to bring in, some things we aren't able to bring in. Here's a sample record from the government website. This is what it looks like. You can visit this at clinicaltrials.gov. So we have the name of a research project. We know who was responsible for this, when it started, when it stopped. This is a long page, how many people participated, what disease is being treated, what drug was being used, so much other information. It's actually a lot of information. This is called the Data Schema. And as you can see here, there's hundreds of fields, data fields, structured data fields. In the original database, we did not try to bring all of these into Wikidata. We're trying to bring in only the fields that are relevant to the Wiki community or that have some other application that Wiki people can engage with. And this is characteristic of Wikidata. Wikidata is not a project specifically for machines to do queries. Wikidata is a place where you put information of relevance to humans that humans might actually read in the database. And once we got it into Wikidata, we did Wiki-style, anyone can edit data curation. Various people in the Wiki community, either as humans or sometimes with semi-automated bot-supported processes, curated the data in ways that are common in the Wiki community. I can't briefly explain how this works. It's Wiki magic. If you're interested to see what the Wiki community is doing, just go to Wikidata, go to any of the community forums and see what kind of questions people are posting. There's thousands of people doing many hundreds of projects. There's no way I can explain it briefly, but I can tell you that humans are interested in this data. They're curating it in different ways. If you want to see what's happening in WikiProject Clinical Trials, we've also got a documentation page. It's called WikiProject Clinical Trials. You can go there, post comments, see some of the other data that we have available. This is the general model of Wikidata. If someone's doing a project, they set up a documentation page, they invite community comments. This is how it works. So that's what we did. Now, why does this matter? It matters because we're bringing new medical knowledge to the Wiki community and to the larger world. So what kind of medical knowledge do I mean? We're able to do queries that were not possible in the original clinicaltrials.gov database. There's certain kind of searches that the original website allows. And when you move this information, and it's free and open information, it's work of the US government or that's what the people, when they enter it into the website, it's available for export from clinicaltrials.gov to other projects. When it gets into Wikidata, we can do new kinds of queries in new kinds of ways. Apple has their Siri, Amazon has their Alexa. Here in the Wiki space, we've got this person, WikiProject, who is behind the scenes sorting out many databases, giving people answers to queries, providing all kinds of answers. So I'm going to put this in human readable terms. You have to put these in a language called Sparkle, a query language to ask them. But some of the things you can ask is, Wikidata, WikiProject, can you please show me all the clinical trials for a particular disease or the trials in my city? There's all these questions you can ask, and people come up with questions. So if you wanted to see what are the clinical trials on COVID, that's been very relevant lately. The world has been more interested in this kind of research. You can ask this in this system, and you can ask multiple questions at once to filter your results. Like, just show me the COVID clinical trials in cities with a population of a certain size, or by particular scientists at particular universities. There's all these different ways to sort it. When people think about clinical research, they think about it from certain perspectives. When it comes into the Wiki platform, it gets remixed in ways that are unexpected. Like, for example, something that I think is particularly important is being able to sort clinical trials by research institute. We have a lot of students at a lot of universities editing Wiki, and I'm anticipating in the future that the day is going to come when every clinical trial and every research project at every university is part of the Wikidata profile for that university, and we can well understand the relationship between research and universities and communities. Now, what's the context of Wikipedia medicine? Why don't we just leave this in clinicaltrials.gov? Why should anyone care about Wiki at all? This has been well discussed. You can read lots of papers about the position of Wikipedia in the medical ecosystem and what the research says. I recommend this paper that just came out recently. Wikipedia is very popular as a health information resource. Many people access it in many places. Lots of academic papers you can read about this. There's also a Wikipedia article on the topic. You can get some more context there. If you want to know about a specific case, we even have a Wikipedia article on how Wikipedia, Wikidata, the translations and everything else covered COVID. I recommend reading this Wikipedia article as well. If you want a summary of all the research on medicine and Wikipedia, you can go into Wikipedia, Wikidata, run this query, show me health information on Wikipedia. There's 119 scholarly articles. So you can check out what the academic literature and the reviews have said. We have different ways of visualizing this information. If you're not familiar with this is Wikidata Profiles. This is a tool called Scholia. It's from something called the WikiCite collection of academic publications, very important to Wiki community. We try to find the best sources and map things out. I'm not saying in this project that clinical trials are appropriate for Wikipedia. They're really not. They're primary data. It's only rarely that we have Wikipedia articles on clinical trials. I'm really talking about the structured data, new ways to look at the database, remix it, and come out with new information. Doing your research in Wikidata, not necessarily in Wikipedia. Only extraordinary trials have Wikipedia articles because of the notability criteria. But what can we do when this information comes to be in Wikidata? We remix it in lots of ways. And now I'm going to give credit to some of these partners that I mentioned at the beginning. So where this started, there's the source information, the United States government website, clinicaltrials.gov. There's a Duke University project called Clinical Trials Transformation Initiative, which has formatted the original website as structured data that's very easy to import into other projects. So we actually used this collection, not the original website. We used this collection from Duke to import into Wikidata. Thanks, Sherry Tibbs at Duke University for importing 300,000 records and matching these records from clinicaltrials.gov and the Clinical Trials Transformation Initiative into Wikidata's data model. We can't just import a data set, we have to map it to Wikidata's system of labels. After this information was in Wikidata, there's another organization, another wiki. This isn't a Wikimedia wiki, this is a community wiki, but they still produce free and open data, ClinWiki. They had their own community of volunteers. This is patients and families, people who have an interest in clinical trials. They're curating their own data sets independently of this project, independently of Wikidata. They just have free and open data where they're tagging up the clinical trials data set in ways that's relevant to them. They donated their data set to Wikidata. We have their data. They also pulled data out of Wikidata to improve their project. So we have a mutual exchange with a community project. So thanks Willie, thanks Amy, and thanks everyone who's volunteered for ClinWiki to produce free and open data that just circulates around the internet for people to reuse in all kinds of new ways. Vanderbilt University has an existing project for their own benefit in their own library system to catalog every faculty and researcher at the university and match them with the academic articles that they're publishing. This doesn't necessarily have anything to do with clinical trials. However, this is a university compiling a free and open data set for their own benefit. And with the tool that they made, Vanderbot, a robot from Vanderbilt, they exported their faculty profiles from the library system into Wikidata. That affects this clinical trials project in a few ways. It means that when they have researchers at their university who have also been the investigators for clinical trials, we're able to do queries for people at Vanderbilt, show us all the publications from people at Vanderbilt, show us all the clinical trials which have come from people at Vanderbilt. They also disambiguated research sites. Typically, if there's a clinical trial, it can happen in any number of laboratories, any number of departments. And sometimes it's unclear what's the relationship between the laboratory and the university. So Vanderbilt, they did all kinds of disambiguation. So thanks Steve, thanks Cliff, thanks Philip for organizing this project. They didn't have clinical trials in mind when they started, but what a powerful contribution to this project. I wish that more universities would have free and open data about their research projects and research outcomes. There's an organization called PCORI. They do research. They happen to do clinical trials. They do other things as well that are for the benefit of patients. A lot of clinical research, this is just the nature of the industry, it has some commercial interest in mind. It's from the pharma companies. But this is an organization that's more community focused. There's not many of those in the clinical trial space. And they were able to provide funding data about trials that they funded, trials in their network. They put this into Wikidata. And when they put this into Wikidata, that enriches our entire ecosystem by matching clinical trials that perhaps weren't clearly indicated. The funders weren't clearly indicated in the original record at clinicaltrials.gov. But now that it's in Wikidata, we're bringing in new data sets, and this gives us new insight. We can't go into clinicaltrials.gov and edit their database. That's just not permissible. But we can bring in multiple data sets into Wikidata, and we get new insights into funders. So thanks, Jeffrey, for coordinating this. I showed you earlier this profile, this project, Wiki site, where we're taking records of every academic paper ever published, trying to integrate those into Wikidata. This has multiple purposes. It helps researchers better find research papers, to do research outside of Wiki, inside the Wiki ecosystem. It helps Wikipedia editors make sure that they're citing the best available scholarly and academic research when they're writing a Wikipedia article on some kind of science or academic topic. Well, when we import clinical trials and make that available, this existing project, Scholia, that profiles everything in the wiki site, it helps to match clinical trials with the people who organized them, with the papers that came out of those trials. the subjects of these trials, so that if somebody's searching for something in Wikidata, diseases or drugs, we can find the papers on these kinds of things, match it to clinical trials. So thanks, Daniel. Thanks, Finn. Thanks, Egon, for developing the Scolia project. It's bigger than Scolia. It supports other things too. I contribute to Scolia as well. I work with these people on their team independently of the clinical trial stuff, just for disclosure. Wikimedia Bangladesh. There's wiki communities around the world. You all are at a conference right now for WikiConference North America, this region, but there's wiki communities around the world organizing their own events, organizing their own activities. Wikimedia Bangladesh, Bengali language, Bangla language. This organization, they translated some medical terms, some drug terms into their own language, put that into Wikidata. This has two effects. One effect is the one that's easier to explain. It makes information more accessible in Bangla language Wikipedia, health information, just for drugs, just for diseases, not necessarily for clinical research. But when these translations exist, for whatever purpose, maybe they were editing Wikipedia articles about diseases and drugs, but now that means that if somebody does queries about clinical trials for particular diseases, we can share information output. The tool can give output in Bangla. So we can provide it in this other language. Wikimedia Bangladesh organized this kind of translation. There's wiki volunteers around the world who are doing this for all kinds of reasons, but I just want to say thank you. Thank you, Tanvir, for contributing translations in this language. We need more translations of more health content. It's a United States database, but this information is relevant to everybody in the world, and we need to make it more accessible. Finally, I've got collaborators at my own university. Thanks so much, Cherry. Graduate student studying very hard, and also helped with the documentation and sorting of this project out. I'm trying to make this a free and open project. There's parts of it that are still in process. Of course, we haven't curated all the data. Much is left to still be sorted out. Records are incomplete, but we've got models for how to do these kinds of things. What I have is transparent. So if anyone wants to see the research proposal, that's available online. It's through these slides. You can search for it. And we haven't published the scholarly paper about this. It's still in development, but it comes from a lot of people as well. What's coming next? Like what does this mean for Wiki at large? And how will we ever complete this project? Something that, this is my own prediction. I can't say what the future is going to be, but something that I anticipate about Wikidata in general, Wikipedia in general, is that universities are very friendly to Wikipedia. There's Wikipedia editors at so many universities around the world, and universities in general are proud of their researchers, proud of the papers that they publish, proud of the grants that they get, the awards that they get, and proud of all the research projects that they do. I'm anticipating that there's going to come a day that either universities contribute more data to Wikidata, or somehow we get better profiles of every university in the world in Wikidata. And some of the implications of that are going to be that if someone queries about a university through the Wikidata system, that we can say, show me every paper that's ever come out of that university, show me every clinical trial that this university has ever organized, or someone from the university is affiliated with, or that the university has ever hosted. Of course, not all clinical trials happen at universities. Many of them happen at hospitals that just don't have this academic mission to share so much information in the open in the way that universities do. But I think that more universities are going to be trailblazers for this, like the good contributions that we got from Duke and Vanderbilt and my university, the University of Virginia. There's so many other universities that are contributing their data. I think that's where the future is going to be for completeness. Entire universities sharing whatever data they can have in Wikidata to make it more prominent and to make the data more accessible for people to reuse it in many ways. Also, I'm anticipating a future where Wikidata gets more recognition as a place where people can go if they want to export open data and use it for their own purposes. I'm also anticipating that Wikidata is going to be a place increasingly where if somebody has data, they want to share it with the world, and they want to make sure that it reaches the most people with the most efficiency, with the least amount of effort, and gets the most remixing. If they put open licenses on their data and they make it fair, which means fair is a term. It means that people are able to very easily take a machine or take a bot, move it from the original data set and move it into wherever they want, like Wikidata. People are going to see Wikidata and think, I want to take advantage of this. This is a great place to store my data and get it to the people who need it. I'm anticipating more talks about that in the future from many directions. Thanks again to everyone who contributed. Again, Wikipedia and Wikidata are great places to collaborate because so many people can come together and in a uncoordinated way actually meet in Wiki and get all their data in the same place at the same time. Any questions from anybody? Thanks so much.
So thank you so much, Lane. There is one question from Paulina. For the trials that were imported, were these only completed clinical trials with results, or did you also include ongoing trials?
These are ongoing trials and also trials that have never started and also trials that will never start, trials that got canceled before they even started. We imported everything that we could from clinicaltrials.gov. So long before a trial even starts, it's a government requirement that people have to register in this database. So people can do queries like what kind of trials never started, and you can get an answer through this database, or what kind of trials got suspended for some kind of problem. It's not necessarily completed. Also, you can use this to find errors in the original database, and people are doing these kind of things, like what kind of trials have been ongoing for many years and didn't stop on time. That's probably a database error when somebody didn't update the trial when it finished. And so we can surface these kind of things, write queries that find these kind of results also. Other questions?
Great. Well, Paulina added in, this is awesome, and I'd love to see more transparency in this clinical environment. So
I agree. I'd like to see more transparency in every field of research.
That's wonderful. Yeah, so I'm not seeing other questions right now. That Lane shared lots of links. We can put those links in the Etherpad perhaps for folks to look at later. It's just linked from the session.
And slides are on the conference page. They're going to be there.
And the slides are on the conference page, so you can go back and look at those too.
Whenever you like. And come visit WikiProject Clinical Trials if you have questions. Come post to Wikidata if you have questions. There's always people who want to talk to you in the Wiki space.
Great. Well, thank you so much, everyone. Thank you, Lane. This was really great and informative. And we'll go ahead and wrap up. Thank you.
Oh, thank you so much.